and they're like,
Never heard of sugar in your soil.
okay, so most of the time, the people
Control
that
your
they're
emotions,
that
not
they
break under
live
pressure. All this
in
stuff
We
is
are one of the very
meditating
few
with
businesses or
you know.
situations where you
So
can shop
Any great
online,
tips already off the bat, and we're just starting.
to your top box.
Hello and welcome to Healthier Habits, a podcast that discusses challenges and solutions when it comes to health and wellness, as well as connecting you to some local resources in Chicago. My name is Cassandra Zumba.
And I am Yakwache and will be your host. We are the Policy, System, and Environmental Coordinators here at the Chicago Partnership for Health Promotion, a program from the Office of Community Engagement and Neighborhood Health Partnerships at UIC.
How are you doing, yeah?
I am good. How are you doing?
Good. How are you feeling about this?
Well, I'm kind of nervous. We have a very special guest today. And today's our first day of recording, so I don't know, a little nervous. How about you?
Nervous as well, but it's a new challenge, having to practice a new skill that I haven't before. So this is a challenge I kind of appreciate because it's a new path. It's a new challenge in our careers.
Co-producing, hosting a podcast, did you think?
No, I did not think that was going to happen when I got here.
Yeah.
That was kind of the last thing, not even in my at all. You?
No, I wasn't thinking a podcast would be in the cards for me either. But I'm glad it is. And I'm glad it's you that I'm doing.
But I'm glad it's you. I'm glad I have a partner because I could not have done this alone at all. No.
That's so sweet.
Thank you for being here as well. So today is a special episode, not only because it's our debut, but also because we get to introduce ourselves and the organization. This episode will give you some context of why you should spend your time with us. And you're also maybe asking yourself, like, who are we? So
hopefully you've seen our eatmovesave billboards around Chicago or ran into us at the farmers market, summer camp, or your local health fair. Or most likely you partnered with us in your community organization by providing nutrition education throughout our team of nutrition educators. But more on that bit, before we go in, can you please introduce our special guest today?
So today, our special guest has been part of the Chicago Partnership for Health Promotion for the last 16 years. He has started as a nutrition peer educator, then a program coordinator and assistant director, and is currently the director of CPHP. At CPHP, he oversees the implementation of federal nutrition program and staff. He recently earned his Ph.D. in the UIC Community Health Science Division with a focus on institutional behavior and health equity. Who else better to be on our debut episode talking about the organization, our very own, the pushing force behind this podcast, aka our boss, Dr. Daylan Dufelmeier. Welcome.
Thanks for having me.
How are you doing today?
I'm pretty good. Feeling like I'm surrounded by professionals already. So
We're trying our best. We're trying our best.
We are. So what's your first impression of our food production right now? What are you thinking? I know you said professionals, but give us a little more.
I'm impressed. The setup is great.
Okay.
I like the lights, the sound, and of course the host. So I'm feeling good. I think the setup is great. The background is looking good. You see UIC.
Mm-hmm.
You got the city of Chicago
In the back,
skyline. Yeah, this is a Chicago podcast for sure.
We're doing with the best we have. Trying to do a whole production. So hopefully, this goes well. We have a lot more episodes, to go to. So hopefully this.
You have no doubt about it.
This is a great beginning.
It's definitely a good beginning.
So Daylan, let's talk about your experience a little bit in CPHP, how you got involved, your role here in general. Wherever you'd like to start.
A long time ago now, I was introduced to CPHP through some of the people that are still here, actually. They knew of some of the work I was doing elsewhere and invited me to deliver a talk on food systems kind of status or like what was going on in the country at that time. And it was at one of the famous staff enrichment meetings. We're actually in the College of Nursing on the 5th floor. Again, only the old group will know about that room and that place. But so that's how I got introduced to CPHP. And while I was at the staff enrichment, I kind of learned a little bit more about, what they did and what their mission was. And this is at a time when people didn't know what nutrition meant. You had to explain it. I mean, even nowadays, the casual person understands nutrition and they understand public health, that kind of stuff. But back then, if you said you were working in nutrition or you were in a public health program, no one understood what that meant. It was just, this is pre-Michelle Obama's Let's Move campaign. This is when our primary teaching tool was still the food guide pyramid.
Yes.
All those kinds of things. So it was definitely raw. In fact, at one of our statewide convenings, our statewide director at the time gave everyone in the whole state, so about 200 people at the time, a copy of Dr. Seuss's Green Eggs and Ham. This was the analogy at the time that, we were essentially Sam trying to get people to eat healthy. And, it was just, our whole mission was just try it, just try it, just try it. This is also at a time when we only did direct education. So all we did was classes. And, that's our bread and butter. That's how people came to know us. It's what they wanted. And, for a while, we worked in all over the city of Chicago. Our primary work was in the Chicago Public Schools. And then when I started, I was focused on building our relationship with the Chicago Park District. And then also our emergency food program. And so those were kind of my two primary projects early on, and then just, continued to have more responsibility and, continue to grow. And now, I've been the director for a few years now. And like you said, I'm trained as a population health scientist. And so I've spent the last couple of years bringing that kind of training and focus into the work at CPHP and, kind of the work of SNAP-Ed in Chicago. That's what has been driving a lot of our approaches, is thinking about the work as a population health scientist and, how do we affect, the population as opposed to like a single individual in this class, but what's the type of things that we're going to do that affect the broad community, that affect kind of people in general in the city of Chicago and the neighborhoods and communities that we work in.
That sort of sounds like what we also do as PSC.
Well, yeah, I was going to go into that. I think we should kind of give a little snippet of who we are and how we started and what our position is. So, if you want to take it away, maybe talk about us as PSC, Policy Systems and Environmental Coordinators.
Yes. So I started about, I would say maybe 9 months ago in September 18th. And I started off as a PSC. We are in health promotion, right? And I guess there's different things that goes into health promotion. There's the direct education that you did mention, which is also great. But then you also have to think of the policies, the system, and the environmental change strategies that are in place. So PSC thinks about all that. And policy could just be, laws. It could be formal or informal. Systems deal with like different organization structure. And then environmental is like the physical change that you see. So in terms of system, that would be sort of like our meal kit that we do have that's easily accessible to the community. So we have a meal kit, eatmovesave meal kit, that is geared towards SNAP shoppers. So you're able to use your EBT or your link card to purchase some of our boxes, and then they're delivered straight to your door through Topbox. We partner with Topbox, and then they're delivered straight to your door free of charge with the purchase of a SNAP card. We generally work in where people live, play, work, convene, church, religion, all of that. What about you?
So I started in March of 2020, and if that sounds familiar, that's when we all went in shutdown. So I started 2 weeks in, and then we were sent home. So that I remember that very clearly. We were gonna go to.
So I'm gonna take a little.
Yeah, go for it.
Guest privilege here, and Cassandra, you probably know what I'm about to ask, but what was your first introduction to?
Oh, right. The way back. So how Daylan was mentioning that they did a lot of work within schools. So I was in one of the schools I did work in. So shout out to Rams, shout out to Ruiz. They were there as in classroom, and also where I saw, my memory at this point, what I remember is NPs at the lunchroom, just going around chatting, pointing out different foods. At this point, I don't remember exactly what it was, but that was my first introduction for sure. That's where I met a couple people that are still here working alongside with them, and now they are my peers. So that is my initial introduction. So I was 13, 14 maybe.
Really?
Yeah, because they were in my elementary school.
What? I did not know that.
So it's like a full circle moment. So that was the initial, introduction. And then later on, just the paths crossed. And
Wow.
when and then I connected all the dots. I'm like, oh, I met you. So yeah, initial was way back.
Yeah, wow.
Then 2020, I was an NPE, so I did a lot of direct education within the community, actually being mostly on the field. Now I have transitioned as of last year to being a PSC coordinator. And how, I was mentioning that the meal kit is her main project. One of my main projects is this podcast. So this is something I did not think I was going to get involved with. I first thought I was just going to be a producer. But Daylan made choices, assigned people. And then I recruited, because I needed help. I'm like, so hopefully you would co-host me. And he said yes. And here we are. So here we are, just trying to do.
I'm still like shocked that it was 13. I'm just like, what?
Yeah, it's a while back.
Yeah.
But that tells you there's a lot of people here within CPHP that's been here for a long time.
I've seen like 25, 22 years. And 16 for you, Daylan, right?
That's right, 16.
Obviously love what they're doing.
Right.
We're here for a reason, right? And we're all working towards it.
Yeah.
So, yeah.
Yeah, and I mean, I'd like to believe that's the staying power of this kind of work. When people experience the transformative nature of the work that we do, it has long-term lasting impacts.
Yeah.
Most of our staff has been here for, longer than 15 years, which is pretty impressive. Yeah. And even a lot of our newest staff are approaching the 10, 11, 12-year mark. Cassandra, you're 4 years, so like that's impressive. So this is great, So I might ask you, what's keeping you around? What about the work do you like and enjoy and that kind of stuff?
I think it's the new challenges. I started as an MPE. It was right during the pandemic. There was a lot of shift. It was different than what I had signed up for, but just adjusting to that period and then working within the community. And then moving up, I'm like, okay, now it's time. Like I, of course, didn't learn everything I had to learn, but it was time for like an upgrade, right? Or just another challenge that should look at. So that's kind of where I'm at. And again, this project, a whole different challenge, but I enjoy it. I do. Causes me a lot of anxiety, but I enjoy it. What about you? I mean, 16 years is a more than it's worth.
It's it's no small feat. 16 years is a long time, kind of no matter the field. But I really enjoy the challenge of the work, trying to move, a big needle, trying to just make these small incremental changes as best we can, again, as a population health scientist, a lot of the work and the way that I think about it is through policy systems and environmental changes. What are the big things that we can do? The levers that we can control that have the biggest kind of impact. After kind of doing it. There's 1.5 million people in the city of Chicago, 3 million in the city proper, and trying to educate each one of them in a class is monumental, but if we can kind of pull a few levers and change a few policies, and it impacts all of those people, or at least, the primary group that we're focused on, it's a really efficient way of doing things. And, honestly, aside from the work, it's people like the both of you that keep me around as well. Our colleagues, they're fantastic. People are really committed to the work. They're really committed to working in the neighborhoods because the work is hard. Like we're traveling in a variety of neighborhoods around the city of Chicago, and these are not always your neighborhoods that are like the top tourist destinations. So sometimes the work is hard, it's challenging. But, a lot of us are really duty driven and feel compelled to this work, not necessarily like it's a job per se, but like something that we're kind of called to do. And the work is meaningful work. I'm very proud to be able to kind of tell my family and my children, the types of things that I'm working on. And that feels good. It feels like you put in time, you work hard, you see these changes, and they're really positive. So that's what keeps me around, is trying to constantly improve. I'm certainly hoping for the time when I can say, all right, cool, we did it. But we'll see. Maybe this podcast will be
working out the problems.
It'll give you all the tools. So tell me a little about your podcast. What was your vision? What were you thinking? What were you hoping people to get? I know that you say it's a podcast for people who are responsible for others, but kind of unpack what that means.
So we have this podcast, I guess, is nutrition-based podcast. We hope that people learn ways to improve and implement techniques that create a better community and or working environment that encourages healthier habits, which comes with our name.
How we threw that in there.
So not only will we be reiterating like nutrition education, but we hope to connect the audience to other great resources in Chicago.
Yeah, and this is a bit different from like direct education sessions, like exactly how you were pointing out. We can influence more people depending on who you're talking to. So in the sense of we're trying to reach out to those who take some kind of leadership role, who can have influence to facilitate more individuals. Yes, of course, CPHP has been able to reach out to multiple communities, but we also know that it just takes more than one organization to uplift a community. So community leaders and employers that have a unique opportunity to make a change in the masses is very important. And we want to see those leaders who seek to improve their working environment and the health of their employees and to create just healthier habits within their communities.
Yeah. Now, do you expect people to just like listen to the podcast, or like what's your goal? What do you hope that?
So yeah, number one, listener viewership, please like, subscribe, all of that. But of course is just taking note. Hopefully you learn something. And then we're also going to introduce a lot of like different people in here. And we're going to have guests that hopefully you can be able to connect to either professionally or any other manner that you can work together. Or maybe the person who's listening is also someone who can reach out to help others. And you want a spot in the podcast, we can talk. I book all the guests. So just let me know. I'll leave my email there. But yeah, it's kind of just an exchange of ideas. Hopefully you learn something. Hopefully it brings change. And also just sharing our resources, not only us, but the community.
I think one of the things that you told me earlier as you were planning is that you were hoping that the podcast drives people to take action as well.
Yes. Okay.
Right. Take action. I think one of the topics we wanted to also we're going to be touching about is physical activity, healthy eating, the food systems. Maybe, you're thinking of taking your organization or your coworkers to a community garden to build some sort of like bonding. We're going to be touching on that, the process that you can take. And
volunteer more, different ways of just having some kind of mental break and physical break, whether it being within like meeting breaks or just different resources you have within your own building instead of taking the elevator and the stairs. It sounds simple, but it takes a little more thought on the organizing side for everyone else who's there can just make it second nature.
Yeah.
So that's what we're trying to help out.
Yeah. And at the end of the day,
Healthy choice, the easy choice.
that's exactly what I was about to say. At the end of the day, we want to make the healthy choice the easy choice. And you mentioned something about city coverage. I want us to go into that a little bit. I guess for the audience that are listening, what parts of the city do we cover? And what type of interventions do we have as CPHP?
Oh, yeah, great question. We focus on a variety of neighborhoods. We focus mostly on the south and west sides. These are mostly Black and brown communities, but we service everybody who is eligible for SNAP benefit. That's our primary audience, and we go in the areas where there's high concentrations of SNAP users and high numbers of SNAP users. And if you're familiar with any of the city of Chicago kind of demographic maps, poverty, things like this, they all overlay the same, the south and west sides. And so our educators and our teams focus on a particular area and have a couple of contiguous neighborhoods that are connected to each other. And we do work. We partner with community-based organizations in those areas. And we try and help them and, help any community org that is focused on the types of work that we do. And if they're not in the field that we do, but they want our assistance, we work with them as well. If you're trying to support people to lead a healthier life, we're totally interested in partnering with you. We'll if you're working for or with people who are on or eligible for SNAP or any federally means-tested programs, Medicare, Medicaid, things like that, we're your partner. We want to work with you. We're trying to improve the lives of the people, who at a lot of times have been, used up and spit out. Yeah. And so we're, if that's your jam, we're with you. So.
And if they're new to us or hearing us for the first time, what is the best route for them to reach out for any of our kind of services or help at all?
Oh yeah, no problem. I'm sure the link and the description is in the notes. But look us up, the Chicago Partnership for Health Promotion. You can Google us, pull us up. We've got our general website. And we've got our general email on there, but my personal email is also my first name, Daylan, Daylan @uic.edu. And, you can reach out to me and I'll connect you with Cassandra and and, we'll go from there. But yeah, you can reach out to us. All kinds of our social medias will be linked and all that kind of stuff. And more importantly, if you're interested, make sure you let somebody else know.
Yeah.
Right. Spread the word around. And we know you're a visionary. And before we end this, give us what you see. What is the future of CPHP through your visionary eyes?
Wow, that's great. Thank you. But it's a great question. The future of CPHP. We have a number of really interesting things going on right now. Obviously, this podcast is one. I know a lot of people are interested. They've been asking me about the podcast.
No
When's it
pressure.
gonna be ready? No pressure at all. By the time you hear this, I'm sure we'll have already won awards and all that kind of stuff. And yeah, but we're not looking for the accolades. We're looking for the changes.
Right.
We if we only affect one person and that turns into some great changes in the neighborhoods that they work in, then it's all worth it. But the future of what we're working on, again, we have a number of really interesting projects, but there are two that I'm going to just kind of call out right now.
Yeah.
We are developing a TV show geared to younger kids using that Hip Hop to Health program. That's going to be exciting. I hope by the time that you're hearing this, some of the episodes will be ready or they'll be kind of forthcoming, but definitely keep an eye out for that. We're hoping that it's going to be a super dope show.
Cross promotion opportunity.
That's right. And it'll be a resource that's available to kind of anybody and, the different tiers of work. The other thing that will be kind of squarely in the middle by the time you're hearing this is our community marathon. That's starting in the summer of 2024, and we'll be continuing all year long. We hope to keep it going indefinitely. So as soon as you're done listening to this, go look that up right away. We're gonna have walking paths, running paths, all in your neighborhood and across Chicago. You can come meet up with your friends, check out new people, find where the group is meeting in your neighborhood or neighborhood near you, and go meet them. Go check them out. Y'all mentioned earlier, one of the things that we're interested in doing is about building community, and the community marathon is just as much about building community as it is about the exercise. It's a lot easier if you're accountable to your homie. It's like, oh man, y'all is gonna be there. I guess I gotta be there, and so on and so forth. So
I really like that analogy you used once, and I'm going to butcher it, so make sure you correct me on that. But it was the community marathon is what...
community gardening is to farming as our community marathon is to the Chicago. Community gardening, is as much about the community and the relationship building as it is about actually growing and planting and all that kind of stuff. And the same is true for our community marathon. We're not trying to get you out here to, be the next Bank of America marathon winner. We just want you out here hanging out, being a part of the community, being an active participant, being an active member in your community, meeting some friends, all that kind of stuff. And so, we want you to exercise, we want you to be healthy and all that kind of stuff, but we also want you to know your neighbors and be friends and talk and share conversation and engage in all those kind of neighborly activities. So that's right. We like to think about this as much as a community building process as anything else, because we know if we build a community and we're accountable to each other, there's a lot of things that kind of flow from that. We're nicer, we're kind, and we're a little healthier because of it as well.
Yeah. So make sure you bring your walking groups, create a walking group, just bring more people, talk to people, get people encouraged.
Get your family out.
Yeah.
Yeah. So that's what we hope. That's the vision over the next year for CPHP. And we, if you're listening to this, we want you to be a part of it. Check us out. Reach out to us, Cassandra, myself. Any one of us will get you connected. If you want to be a part or run or host a walking group in your neighborhood, let us know. If you're part of a community organization, you want some of our services, you want Cassandra and in person, let us know. We can arrange it. We'll get you out.
Live podcast.
Yeah, live podcast. And then, definitely stay tuned. Check out our library and our lineup for all the episodes.
Yeah.
Check out the ones that you're interested in. Check them all out. And the people that we'll have on the podcast, these are practitioners. These are people that you can reach out to right away. They're live, they're local, they're experts. You can get them. They'll be able to help you solve problems, implement things in your neighborhood. So, check them out. This is a podcast of action. So,
And to add to that, the people that are on here, they're already working in the community. They're not like some random person plucked from somewhere just to talk. They're already working, so they already are aware of some of the things that are going in the community and are willing to, move the needle a little bit in the community as well.
Yeah. So again, if you're out there, you also have some kind of organization or have some kind of expertise and you want to share with the community with Chicago, reach out to us. For sure, we want to speak to you. We want to make sure we spread, as much resources around Chicago as we can. Yeah.
Right.
Thanks for listening to Healthier Habits with your hosts, Cassandra Zumba
And Kwachi.
We hope you enjoyed this conversation. Keep an eye out for more episodes and make sure to subscribe and hit the notification bell.
Here at CPHP, we have the eatmovesave meal kit. This is an e-commerce project dedicated to improving and resolving access to healthy and affordable foods through a meal kit, which is packaged and delivered directly to a family's home throughout Chicago through Typebox. Visit our eatmovesave website for more information on meal kit ordering and delivery.
You can help support the podcast by liking, sharing, and subscribing, following us on our social media accounts on Instagram as eatmovesave Chicago, Facebook eatmovesave Chicago, and YouTube as UIC OCEANHP. Look for the podcast tab for more episodes.
If you'd like more information on partnering with our organization, head over to our website, cphp.uic.edu, and send us a message.
Thank you for joining this chat. Check out our links and resources in the description. See you next time.
Bye.
This institution is an equal opportunity provider. This material is funded by the USDA Supplemental Nutrition Assistance Program, SNAP. Chicago Partnership for Health Promotion is a unit of the Office of Community Engagement and Neighborhood Health Partnerships, representing a network of community-based interventions designed to improve nutrition and reduce disparities in outcomes associated with nutritional diseases, including obesity. CPHP provides high-quality, age, gender, and culturally tailored nutrition education in various venues across the city.
Eat, Move, Save.